But I think there is a way in which we can make the case for these types of conversations to help people really see the benefit around solving some really persistently sticky problems.
Welcome to the Health Pilots podcast, presented by the Center for Care Innovations. This podcast is about strengthening the health and well-being of historically underinvested communities. Every episode offers new ideas and practical advice that you can apply today. This episode was adapted from a webinar featuring participants of Catalyst, CCI's award-winning human-centered design training program. Human-centered design, also known as design thinking, is an approach to problem-solving that is rooted in understanding people's needs and experiences. Our longtime Catalyst collaborator, Chris Conley, dives into how this community of innovators are leading strategic efforts to transform the systems that support historically underinvested populations.
We have Luke Entrup, who's joining us as yet another Catalyst alumni. He's gone through the Catalyst program. He's coached in the program and had a whole career in public health and healthcare, and was at West County and helping them deliver new innovations and work through lots of new ways of serving their patients. And now he's with Evolution, right? Is it Evolution?
That's right. Yeah, that's right.
And he's an executive coach and team builder, where he works to build cultures of innovation and help leaders become more conscious about their leadership and improve the performance while creating a great culture in the organization. So we're really happy to have Luke here with us today. And he agreed that we talked about a number of topics, and he felt that there's a particular type of work session he does with many organizations, whether they're in community-based healthcare or some of the fastest growing startups in the Valley and around the country. It's a work session he does with them to identify their pain points, really try to figure out what's going on with the teams and the culture, and then start to work with those things and get them on the roadmap for possible solutions. And he's starting to incorporate much more design thinking and human-centered design in the techniques of leadership development and organizational development. So we're really happy to have Luke. Luke, I want to welcome you and ask you to kind of tell us a little bit first about your journey and how you kind of came into the world of human-centered design and using design thinking in both healthcare and now leadership development. And then we'll go on to your topic. So welcome.
Wonderful. Yeah. Thank you so much, Chris. It's really exciting for me to be here. I'll just answer that last question straight away, which is I came into design thinking through this group right here. So it's nice to be back. I have not been working in healthcare for the last several years directly. And so it's nice to be back with my roots and to share a little bit about how I've taken the tools that I've learned specifically from this group, CCI and Chris, and I'm now applying it into my work. So yeah, a little bit about my background. I spent about a decade in my early 20s working with coaching emerging talent and coaching young leaders and training young leaders, and then got the itch to do a little bit more mission work in the world and decided to go into public health. And that landed me initially working in global health, but landed me squarely in community health clinics. And as you mentioned, I work for West County Health Centers, who I know is part of the CCI network. I also work for the Petaluma Health Center.
That's right.
And so kind of spent some time in the North Bay in various roles, but really my primary role was always the innovation director within these organizations to really help bring a lot of what CCI is doing into those organizations. And then about 5 years ago, I started to get the itch to kind of head back into my roots and have been squarely for the last 3 years working with organizations, mostly high growth organizations and companies, to help them scale their leadership and their culture and create more strategic alignment within the organization. So I work currently in my coaching firm. We work mostly with high growth companies, working with firms or organizations like Slack, Dropbox, Twitter. So a lot of tech companies, not exclusively tech companies, but that's mostly what I'm doing. And I've been able to really take a lot of the skills that I learned through the training at CCI and begin to apply that into leadership development and culture building within organizations. I think that's a little bit about what we want to talk about today, because I certainly think that the things I'm doing in the tech company can be done within the healthcare space, especially with the skills that exist in this community. So
nice. And just real quick on that whole notion of you got introduced to human-centered design thinking with CCI. Do you remember what it was like to first encounter some of the mindsets, behaviors, principles? What was your initial reaction and why did you take to it?
Yeah, I mean, and that's actually well said. I think the skills were nice, but I think the thing that impacted me most initially were the mindsets. When I really reflect back on that time, it actually is a shift in how we do work and how we actually relate to our roles. So things like deep empathy and really being curious first rather than defensive, and the amount of energy that can happen through the collaborative process, like energy we feel in our bodies that by the end of a good session, or just energy about an idea that we're working on together collectively. That really impacted me pretty deeply, and knew that this was something that I wanted to make a major part of my work. So
nice. Yeah. We could have a whole session on talking about how is that in contrast to how companies and organizations normally develop talent and problem solving and the top down, or being right all the time, or being the smartest person in the room, and how this is really a shift and it's much more human-centered, collaborative. And more effective. And more effective. Yes.
Right.
Why do you think it's more effective?
Well, I think that, what we're doing with a lot of these tools is we're harnessing the collective creativity of an organization, as opposed to being stuck in an expert-driven culture, which is, I think we find this particularly in healthcare a little more so than other industries, where we have experts and we rely on them a lot to not just generate the ideas, but drive the projects. And, these tools really temporarily flatten out an organization. So it really captures the brain power and the creativity from across all quarters of an organization. So both with the mindsets, but also with the tools. So I think that's way more effective at coming up with better ideas, more novel ideas that are going to help us hit our targets. So
nice. So, one of the things, not just on innovation projects, but one of the things you're doing now is really helping organizations develop, get in alignment, understand why they're not clicking as a team, helping them pursue, their goals in a more effective way. And you talked about, when we were preparing for the meeting, you talked a lot about this notion of a work session that you do with them that you find highly effective. So if you could, can you take us through that and why you do it, or who you do it with, and just the background and what you go through to make that happen?
Sure. Yeah, absolutely. And I think about this partly from my own experience working in the safety net, right? But also just, this is something that I think is broadly applicable. I've run it 2-3 dozen times now in a lot of different types of organizations. Mostly at this point, I work with these startups, essentially tech startups at various stages, or very early to some that have already gone public and have thousands of employees. And really I use this process in two situations: when there is maybe some sort of strategic misalignment with the key decision makers in the organization and the teams that they're leading. So the organization is not totally synced up with where they want to go together, or there are a lot of cultural issues that are undermining the strategy. So they maybe have a clear roadmap that they agree upon, but they're not quite able to execute in the way that they want to execute. So that's really where we'll pull out this tool, which I think those that have done the Catalyst program, a lot of this maybe will sound familiar, because we're essentially using a lot of the Catalyst tools, but we're applying it less around workflow design or product design. We're applying it to organizational design and culture building. So that's a little bit of background on it. And maybe would it be helpful if I kind of walk through a few of the phases around how this goes, or?
Yep, perfect.
A good next step. Okay, great. Yeah, basically I'll use one case study around this, knowing that there's been a lot of permutations and kind of revisions on this, but I think I'll just pick one and then we can talk about how this has been modified, how we use it differently. So in this case, I'm thinking about a financial technology company that's grown pretty rapidly, one that most people would recognize, and they decided they wanted to gather their 50 most senior leaders in the organization. They've got about 2,000 employees at this point. So big, pretty big. And they have had a lot of challenge around getting everybody on the same page. And they've had some challenges around some culture not quite being aligned with strategy. So what we did initially was we got everybody in an offsite for 2 days outside of the office, which is really important to do this type of work, especially when we're talking about strategy. And we first had the founders come up and do a timeline of the founding of the company until now. And in high growth companies, and I think this is true in healthcare, there's always kind of a bit of churn, especially in the management ranks, that we're constantly kind of like in resource strapped environments in particular, we've got a bit of churn. So it's always nice to do like the story of like the organization up until this point through the lens of leadership. And so we do this kind of as a journey map up on the wall where we get, some butcher paper and like people bring artifacts, historical artifacts related to the culture or certain moments in the company's history. And we get it to present day. And then a little bit of conversation, usually from the key leaders around the vision of where we want to be going and the conditions, the environment in which we're operating right now. So we've got some strategic directions that the organization wants to take. This is where we really get into some of the skills. So we will take each kind of strategic priority and we'll start by just using sticky notes and mapping out all of the pain points, whether they're strategic pain points, cultural pain points, and we just get a mass of pain points under each of these priorities. And usually this takes up a lot of space. In this case, we broke them up into groups because there were 50 people. Each of 10 people took one of 5 or 6 of these priorities, and we just map everything out around all of the pain points. And then we do a little bit of sorting, and we use some 2x2 matrix, if people remember that, where we'll kind of try to find the ones that are like the biggest impact, the biggest pain points. We'll do some voting and we'll really surface the key pain points.
What level are these pain points flying at? Like when you're talking about kind of priorities for an organization or a group, what kind of pain points do they surface and how does it keep from getting too negative?
Yeah, I mean, so there's a lot of different altitudes. Some of the more important altitudes are like, in these environments, something like, I don't know, marketing and sales aren't talking, right? So like, we're not getting good leads from marketing into sales, for example. And those two teams aren't talking. Or we've had a series of failures around design in our user experience because we haven't included enough users in the design or something. There's been something around the product design cycle.
People are really surfacing issues that are happening in the organization that they see as, they want to identify as a potential problem.
Exactly. And this is the beauty of this process. It really flattens it out. And so people can essentially have their point of view heard in a way that isn't as hierarchical, that needs to go up the chain of command. We set the conditions around these conversations to make them as safe as possible so we can flatten it out and surface some of the underlying issues from across the organization. And I think this is the beauty of design thinking in a lot of ways, is that it allows these conversations to unfold in a way that's a little safer and a little more effective at, then taking action around. So once we've kind of surfaced the key ones, we'll do some heat, like ranking and voting. So we surface a few key challenges, and then we'll go into an ideation phase around doing ways of statements for solving these. We may surface 5 key pain points that we want to spend the rest of our session designing around. And we will do kind of the classic then ideation session of brainstorming and create work groups. And usually at this point, we have created enough alignment and endorsement that it's pretty clear that the organization needs to address these 3 or 4 initiatives. And then there will be a process that will help guide them through after these offsites, where they'll set up project groups and go back and collect data from the people that these ideas are really going to impact. And then it becomes much more of a 3 to 6 to 1 year process around how to really solve these big pain points. Mm-hmm. So that's it in a nutshell. There's a lot of nuances to it, a lot of adaptations, but it's essentially using a lot of the sticky notes, and we'll use storyboarding a lot in mapping out either the solutions or the pain points.
Nice. So that's
and I'll pause there.
Yeah. What you're describing is the genesis of organizational change in a more human-centered way, where you're involving the folks that are experiencing the pain points, that feel the dysfunction or feel the lack of performance or lack of achieving their goals. And it starts with them, but it really kicks off essentially projects. And so these aren't innovation projects, but it's really to help develop the organization to achieve their goals.
Yeah, that's right. And I think, I've seen these surface problems that I definitely would not be surfaced otherwise in kind of the classic, one-on-one meetings and team meetings, the way business usually happens because we temporarily flatten out the organization. So some really amazing things have come out of this, in organizations that have been really locked otherwise.
I mean, I love that you're describing a process that we all find very familiar, but using it in a context that we all need and maybe a little bit harder to work on is cultural things or organizational things. I'm sure that, as we get into Q&A, I'm sure people are going to be curious about how I apply this to a small, non-high growth startup in my own organization. How does that translate? But you're using the skills that we've all learned in a context that has a big impact on an organization. So I think it's not like it's some mysterious process, but it's a way of applying the method with people working on the organization. Super inspiring.
Yeah, that's right. Yeah. Yeah. And I just to add on that a little bit, sometimes I will actually get way more specific around the question. So I gave you this example around strategic initiatives that the organization wants to embark on and what are the pain points related to that. Sometimes we will go in and we'll run the same process that I described, but we'll just ask about the culture of the organization and say, tell us about the pain points that people are experiencing related to working at this company or at this health center. And we'll run this exactly what I just described, but be much more strategic about culture or employee experience or what's it like to lead within this organization. So we look at how we're developing leaders using all of these same tools, but very much around, culture and leadership.
Nice. Okay. We got some questions coming in. So somebody chatted in, how big are these groups? What kind of permission do you need to get from leadership to set expectations and levels set beforehand? How much prep work is there in developing this approach and permission to work?
So my point of view on this, and I know this is sometimes a little complicated, especially in the healthcare space, but my point of view on this is I usually will not really work with organizations unless the leadership is really bought into this. And so there's usually some work that we need to do first with the C-suite top leaders. And so for me, that often looks like at least having a series of conversations over the phone, but often we'll actually do a one-day offsite with them first around this and have them kind of run through their own process and talk about how they're functioning as a team. So that's that aside. I mean, that's basically how we work. But I think there is a way in which we can make the case for these types of conversations to help people really see the benefit around solving some really persistently sticky problems. That's usually a good way to make the case. But I do think you need to have organizational buy-in, especially when we start talking about surfacing pain points in a non-traditional way that isn't necessarily hierarchical.
Right.
Can I ask a follow-up question on that? Like you said that you might narrow it down to 5 pain points, or like, do they help framing your learning question or like the design constraint? Like, how are the leadership involved in so that you don't go through all this and they're like, this actually isn't the direction? Or do you get some people who are like, you can do what you have current launch? Like what normally happens?
It's such an important question. So what I do is I prep the leadership team ahead of time and say, there may be some ideas that get surfaced in this that you're just not going to pursue and it's not aligned. And there may be some ideas that are a little hard for you to hear, but and that need to be addressed, but we don't really need to invest in that. We treat this as kind of like an information gathering session. And I let them actually lead the discussion. I set them up and kind of teach them, you're going to lead the discussion about narrowing these down. So when we get into using the 2x2 matrix and highlighting which initiatives we're actually going to green light and move forward and then ideate on, they actually, usually the CEO or the co-founder team, I have them actually lead that so that they can make the case against an idea that maybe had a lot of popular support. And they drive that. So this is where I think leadership buy-in is really important around some of this stuff.
I mean, in some ways, though, you want things to surface from the organization that the leaders will address that maybe they weren't aware of. And you're not saying that they go in with their own agenda of what problems they want to solve, because that would defeat the whole purpose in some ways.
Yes, exactly. So there's a lot of prep that goes in that I do with them around as I described, like there's going to be some things that you hear that might be uncomfortable. Are you really okay with this? And the good ones do. And most of them that I work with, they want this. This is why they're doing this process, is to surface things, especially around dynamics that are, we call the PPP, persistently painful patterns, right? That just keep moving through an organization. I think that's what this process really helps solve, is like getting at root cause. So.
Yeah. Nice. Persistently painful problems? Patterns.
Yeah. I also just don't ever want to box anybody in to have to make a decision in the moment around that. So we build in a lot of mechanisms for them to be able to kind of shape that conversation as we're going along.
I mean, I think that's one of the hardest things to remember as we're talking about any of these things, is this is all iterative. I was going to make that point earlier. And it starts a process. It doesn't end it, and you aren't making all the decisions. And you could come back after a little, information gathering on one of those pain points, and you take it in a whole new direction because of what you learned from actually going and looking what's happening, right? So it's iterative. It's not this finite thing that just happens and it's done.
So this whole issue of, you mentioned flattening it out so folks are more non-hierarchical in this retreat, and establishing psychological safety. So can you say more about both of those? So important.
Yeah, sure. I think some of it is what we talked about. So making sure that the leadership is really bought into the process so that they're not actively undermining the ideation phase or surfacing of the pain points. So we'll do some kind of warm-up exercises around kind of the creative thinking. And I think one of the tools that CCI used to teach, I don't know if you still teach, but like the idea of sacred cows, or kind of these like untouchable ideas so we'll introduce that concept in a slightly different way. We'll use some kind of like interactive exercises that get people kind of thinking outside the box. And so we prime them so that we're suspending kind of public judgment around ideas so that you get the most ideas out at first. And then there's a process of like, the narrowing phasing of like, all right, what are the most important ones? But we want to set the conditions so that people can just speak what's on their mind, knowing that some things are a little riskier to mention, especially when we start getting into like office politics and kind of like cross-functional collaboration, that things can get a little hairy there. So we also we're very tight in our facilitation around like not cross-talking. We do, what else do we do? We have a cone of silence around all of these events. So we ask people not to share outside of who's there. At the end of the session, we'll come up with a communication plan that we communicate out to people that weren't at the session. Otherwise, everything that happens there stays there. I'm trying to think if there's anything else notable about that. For me, I mean, the key really comes down to what we talked about a moment ago, just around like making sure we have the leadership team set up in a way that they're ready for this conversation. Is that helpful, Wendy?
Yes, all very helpful. And for the leadership, are they the top leadership are in the room the whole time? And if so, how do you work with that leader who just can't help themselves when they want to say something that's going to kind of shut down the others?
I definitely pull. So I have the luxury of being an external consultant for this. So I think that's a little bit different than a lot of the people that are on this call where you're actually maybe reporting up to this person. So what I do is I pull them aside and tell them that we're not going to do it this way for this meeting. Remember what we talked about. And I do a lot of prep with them saying, so what my pitch to them always is, when there's an opportunity to share something you're learning about yourself as a leader and share about how you're growing as a leader in this process, it's best if you're the first person to do that and model that. When it comes time to us surfacing new ideas and surfacing pain points and surfacing fresh observations about the organization that you're leading, it's best if you're the last person to speak. So we want them out front on kind of like vulnerability, and we want them bringing up the rear on generating ideas.
That's a really great insight or coaching point. I love that. The whole notion of having people be showing their vulnerability and sharing reflective thinking in the moment, and then not jumping in to say everything that they think is wrong with the organization. First in one, last in the other. Beautiful articulation of that point. Love it.
So if they're not bought in, and this is where it gets a little complicated, and I have done this in sub work groups as well, where then we'll do this in like a smaller organization within an organization, and then I'll work with that leadership team to develop a communication and kind of an influencing, managing up plan about how to get buy-in from the top. But that's definitely not ideal. You can run it in smaller groups though.
Love it. Thanks.
Just one last thing on the flattening things out that I'll just mention, Wendy, is I make very clear that it's a temporary process, right? We're just going to flatten this out for a couple of hours and then we'll go back to kind of like the leadership team will need to decide what we're going to do with this. So everybody knows, like, just because you put an idea out doesn't mean that we're going to pursue it.
Mm-hmm.
That's so important. That whole decision-making structure being clear. I think that's a big one.
I mean, you have experience with the healthcare organizations and now with a lot of leaders in large organizations, fast-growing startups, technology. But how do you think about that now if you put yourself back in healthcare field or even community development, working with social service organizations? How do you see these things translating or different kind of strategies given that you might be working from within rather than bringing in a consultant?
Well, I think, partly Wendy's question illuminates part of that, which is, there is typically a little bit more kind of internal buy-in that needs to happen in our world here. The thing that has struck me is that when we look at just like using design thinking to impact and create change within an organization, I've seen just as much, if not more, within the group here on the CCI call as I have seen within some of these tech startups that a lot of these tools kind of were created adjacent to, right? And so the scrappiness of people that work in resource constrained environments, I think really lends itself well to being very connected to your end user, aka your patients or your frontline staff. There's a way in which you have your finger on the pulse of your users in a way that a lot of other sectors don't. So I think that's just the concept of patient-centered care has been around for a while. So there's these circuits open within a lot of health systems, health centers that know how to be close to their patients. Where there is a difference, I think, is a lot of the startups have people that are designers. And so they're using these tools for product design and
services,
some workflow design, service delivery. Where they're not using it is in what we're talking about, org design and leadership design and getting teams aligned. And so one of the things I've been trying to do is actually grab a lot of these designers that are doing product design and have them start facilitating a lot of these meetings internally. So that's a little bit of a difference here. They have the capacity within the organization. They're just solely using it usually on product design or engineering.
So what do they bring that you see? Why do you pull them? What do they bring in terms of mindset, behavior, talents that helps in that situation?
Yeah, I mean, a lot of it is the greeting every statement with curiosity, slowing a conversation down to make sure that we're really understanding a problem very clearly, framing, just the simple techniques of using how might we statements, or they come with that already. They come with knowing how to storyboard or knowing how to cluster sticky notes, that maybe other people in the organization don't. So they come with the toolkit and they come with the ability to take a team through a process. Even though I may send a designer in with an HR team to work on redesigning their hiring and onboarding process, right? It's like a problem that's not about tech design or user interface, but they have the skill set to go in and be able to do that with just a little bit of help.
Yeah, I think that's really important. Some of the skills that you mentioned, the orientation towards, as you said in the beginning, working this way, which is a little bit different than, treating every question with curiosity. This is the designer's bane, as they're curious about the world. They're curious of why can't we do it a different way? And they're always looking for that opening to do something in a little bit different, better, more interesting way. So if you don't avail yourself of hiring designers, those are the skills you want to start cultivating in your team. Those are the skills you want to keep practicing and realize it's not just a human-centered design method, just an individual tool or technique that CCI is advocating for. It's really a way of working and a behavioral profile that you're developing to have in your culture, to have in your organization, so you can solve many different kinds of problems with these tools.